Hello and good morning to our Latinx community of Santa Clara County. My name is Dr. Amna Khan. I'm a pediatrician who has the privilege of serving our patients here at Santa Clara Valley Medical Center. In addition to being a physician, I'm also a mother to 3 young children, a wife, and a daughter of Salvadoran immigrants. I come to you today with a very important message about COVID-19 vaccination. We as healthcare providers understand that many of our community members feel hesitant to vaccinate themselves against COVID-19 due to the fact that the vaccine is relatively new and was developed in a very short amount of time. First, let's talk about the science behind COVID-19 vaccination. The first 2 vaccines that have been available for patient use are the Moderna and Pfizer vaccines. These 2 vaccines use mRNA vaccine technology. And contrary to what you might have heard, this vaccine technology was actually developed over 30 years ago. mRNA vaccine technology that's used in the Moderna and Pfizer vaccines do not alter a patient's genetic code or DNA. That means that these vaccines do not have the capability of altering your genetic code in any capacity. The third vaccine that was recently released under the FDA's emergency authorization use is the Johnson & Johnson Jansen vaccine. This vaccine uses slightly different technology than the Moderna and Pfizer, but equally is unable to interact with the patient's DNA and alter your genetic makeup. All 3 of these vaccines have been rigorously tested in clinical trials that used a very diverse patient population of different ages, ethnic background, and also medical conditions. Even though these vaccines were developed relatively quickly, we want to assure you that they have been studied thoroughly, just as other vaccines that we have been using with children and adults for decades. All 3 of these vaccines are considered safe and effective in preventing severe COVID disease and death. The most common side effects of COVID-19 vaccination include mild symptoms such as soreness, redness, swelling, or itching at the injection site. Some patients may also experience moderate side effects such as mild fever, body ache, and headache, which usually resolves between 2 to 3 days. Severe allergic reaction to COVID-19 vaccination, also known as anaphylaxis, is extremely rare. All patients are monitored for 15 minutes after vaccination in order to assess if any severe side effect occurs. Vaccination is the safest way to confer immunity against this disease versus acquiring COVID itself. As you know, acquiring COVID-19 can cause severe illness and death. It is probable that the vaccine provides a stronger and more long-lasting immunity against COVID-19. Therefore, even if you have contracted and recuperated from COVID-19, we highly recommend you get vaccinated in order to ensure your body's adequate immune defense against reinfection. COVID-19 vaccination is safe in pregnant and lactating women. Our experts in maternal and fetal medicine have issued statements to the safety and efficacy of these vaccines in this patient population. As we've already discussed, these vaccines do not contain any live virus and cannot alter in any way the DNA of mother or baby. Mothers who are vaccinated against COVID-19 confer some immunity via antibodies across breast milk and placenta to their babies. This is an added benefit since babies currently are not eligible for COVID-19 vaccination. We consider all of these vaccines to be extremely safe and effective. Therefore, when it is your chance to be vaccinated, we recommend you are vaccinated with whichever of these 3 vaccines is available at the time. Just to reemphasize, not only are these vaccines safe and effective, they are free to all. We need everyone in our community to be vaccinated as soon as possible, to continue wearing face masks, to socially distance, and to avoid large social gatherings so we can prevent further death and suffering from this long-standing pandemic. Our goals are the same as yours. We wish to return to our lives pre-pandemic where we could interact with friends and family and send our children off to school safely with the peace of mind and security of knowing that COVID-19 wasn't going to rob us of those experiences. In summary, COVID vaccination offers us so many benefits at such little risk for all of our patients. Please share this information with all of your friends and family. Vaccinating ourselves is our best shot at restoring our community's health. Thank you for your time and consideration today, and please stay safe.